Good morning, everyone. Good afternoon. Today, I will be talking about OCD, but first I would like to start with a story. I'm going to tell a story about Ellen. Ellen is a friend of a friend. Ellen counts. She counts everything in 7. 7 is her lucky number. When I asked her, like, what's up with 7, she said it's a good number. So, I came to the conclusion that Ellen has OCD. All right. That was my story. So today in this presentation, I would like to talk about a couple of things about OCD. I would like to talk about what do OCD stand for, what is defined, the causes, and also the components, the signs and symptoms, and as well as the diagnosis and the treatment.
Hey.
No offense. There we go. All right, OCD stands for obsessive compulsive disorder. OCD defined. OCD is a mental illness that affects people. It makes them obsess about certain things like hand washing, counting, and they do rituals. It can cause anxiety and problems with functioning. This can unfortunately lead people to be hospitalized. This is the One Flew Over the Cuckoo's Nest. I hope a lot of people have watched this movie because it's a really awesome movie. The DSM-5 now classifies OCD in its own category with other obsessive behaviors and repetitive behaviors. Previously, it was classified as an anxiety disorder because it causes anxiety in people who have it. All right. 1 out of 50 people have OCD. A lot of them go untreated, undiagnosed. I think it's because a lot of people are ashamed of having OCD. It's very common. I think a lot of people in this class have certain things that make them tick, so it's normal. Causes. The causes of OCD is not really clearly defined yet. There are some assumptions that's a chemical thing, that it's something in your brain. They haven't decided what gene causes OCD, but also they say that it can be hereditary, like that, and also you can learn it from your environment. You can pick up on being OCD. There's 2 components of obsessive compulsive disorder. There's obsession, that's the thought. People think about getting sick all the time. They think about the house catching on fire, so they check the house 5,000 times, they check the lights 5,000 times, they don't think it's all. And the second part is the obsession. That's the act. So if you could obsess about germs, you wash your hands. If you obsess about TV, always being on, you check it constantly. Signs and symptoms. Signs and symptoms are washing your hands until you develop sores. Your hands become really raw. You just wash your hands constantly. Checking locks several times. Normally, a normal person checks it one time and feel comfortable about it. A person with OCD doesn't do that. They check it a good 10 times or more. Perform rituals. Counting, in the case of Ellen, she'd be ritual number 7. Also, you can touch things with certain hands. Touching with the right hand is good for some people, but touching with the right hand is good for other people. So it all matters on the person. Diagnosis. There's many different diagnoses or how to get diagnosed. You can get diagnosed with a physical exam. They're looking at the blood, heart rate, traditional checkups. Also, if they do a physical, psychological exam, they ask you questions. But the thing about this questionnaire is really not clear and set in stone. You can test positive for OCD, but really don't have it. It's all about you knowing yourself and knowing if you have it or if you have it. The treatment. There's many treatment options for a person with OCD. You have psychological therapy, you have cognitive therapy, and you have drug therapy. With drug therapy, they use antidepressants. It's not really suggested for people that's younger. The side effects is sleep sleep effects. You won't be able to sleep a lot. And in conclusion, OCD is a mental disorder that makes people obsess about behaviors. Living with OCD is very difficult, but with treatment it can be managed. And there's not nothing to be ashamed of. If you look at the list right here, you can see a lot of famous people. They have OCD and they really thrive, and they excel. But from this presentation today, I hope that you understand how to manage it, how to recognize it, and how to deal with it. If there's any questions, and here are my sources.